Hello, I'm Dr. Sagar Lonial from the Winship Cancer Institute of Emory University in Atlanta, Georgia. And I'm here at the ASCO 2016 meeting, and I'm going to talk a little bit about an overview of some of the new data that's been presented this week, some very exciting data. So there were probably 3 or 4 big categories of information that came out. Obviously the biggest and most exciting story is the data with daratumumab in combination with bortezomib and dexamethasone, the CASTOR study. And I think that the benefit that we're seeing in terms of hazard ratio favoring the treatment with daratumumab is one of the best hazard ratios we've ever seen in a trial in myeloma, suggesting that the effective and benefit of daratumumab is not just in combination with lenalidomide or pomalidomide or as a single agent, but that there can in fact be synergy when combined with a proteasome inhibitor as well. I think the other big data sets that are of significant excitement revolve around the use of high-dose therapy and autologous transplant. Dr. Cabo and his colleagues presented very interesting data about the benefit of transplant, even in the context of bortezomib-based induction in a large European trial. And I think what's really quite striking is a couple of things. First, we continue to see the benefit of early high-dose therapy in that large randomized trial. But second, I think we really have to start to begin to question what the induction regimen is as well as the consolidation. Because in my view, the use of cyclophosphamide up front and then the use of melphalan in the consolidation phase, low-dose melphalan, probably is suboptimal to what we've seen in other more modern induction regimens, and perhaps the benefit of transplant will be less if you use better upfront therapy. I think the third data set that we saw that was really quite exciting was the use of maintenance lenalidomide. And there's been a bit of a mix in the picture in terms of whether maintenance lenalidomide can improve survival. The US trials showed a benefit in survival. The European trials have not shown a benefit in survival. But in this large, very long follow-up meta-analysis presented by a number of different groups in aggregate, we see a very significant benefit in terms of overall survival, suggesting that lenalidomide does not in fact shorten responses after relapse, and that there is a significant survival benefit associated with lenalidomide maintenance. I think that there were a couple of other data sets that looked at novel agents such as ixazomib in combination with pomalidomide, ixazomib in combination with cyclophosphamide, and I think what we're seeing is that these combinations of now oral-based proteasome inhibitors are very active and are very patient-friendly, allowing them to have fewer visits to the office or the infusion center with very good efficacy, both in combination with cyclophosphamide and pomalidomide. So I think in aggregate it's been a great meeting, lots of exciting myeloma data available here, more data coming next week at EHA, looking at daratumumab with lenalidomide and dexamethasone. And I think now that we have all these new tools, figuring out how to combine them remains the goal for the next few years. Thank you.